Welcome everyone to the National Hispanic Pharmacist Association third annual conference today, July 24th, 2021. Next slide, please. For today, the topic that we will be covering is pharmacist community engagement, increasing COVID-19 vaccine confidence among Latinx communities. And our keynote speaker is Dr. Sandra Leal, Executive Vice President, Tabula, Rasa Healthcare and Professional Affairs. Welcome, everyone. Next slide, please. The conference agenda for today, I will be going over introduction and welcome. And my name's Maria Hearns-Rivas. I am the president of the National Hispanic Pharmacist Association. I am also an ambulatory care clinical pharmacist at Kaiser Permanente, Napa-Solano. Then we'll move on to the announcement of NHPA leadership members. Then we will have our keynote speaker, Dr. Sandra Leal. We will also have a Q&A session. And after that, we'll be followed by the NHPA graduate presentation, and then we'll have closing remarks and a networking session. And I really hope that you are all able to join us for the networking session. I do look forward to seeing you all there. Next slide, please. In terms of the networking sessions, if you could please send a message to everyone with regards to which of these groups you would like to participate in. We have a board of directors group, if you'd like to come and meet them, regional directors and assistant regional directors, programs committee and development committee. Again, you don't have to specifically belong to these committees or be part of the board, but if you'd like to come and meet and greet and an opportunity to network with others, we'd be happy to have you there. And again, once you've decided which group you'd like to participate in, please send a message to everyone, and then our NHHF staff will be able to designate you to those groups. If you want to change again later on, you can also send out another message to everyone, and our staff will be able to move you around the group. So thank you. Next slide, please. So again, as we mentioned earlier, here we go into the introduction and to the welcome. Next slide, please. We will also go over membership update, recognizing Dr. Christopher Alvarado, and I will also be introducing the incoming NHPA board, as well as the NHPA national leadership. Next slide, please. So our mission for NHPA is to empower Hispanic pharmacists and other members to improve the health of Hispanic populations in collaboration with public and private sector partners. Our vision is to be the leading pharmacy organization for improving the health of Hispanic populations in the United States. We were established in 2018 in support by the leaders from the National Hispanic Health Foundation, CVS Health, Pharma, and Walmart. Next slide, please. So as of today, this is our NHPA membership. We're just shy of 500 members, predominantly made up of student pharmacists, who we hope will move on to becoming our pharmacist members. And we definitely need to work on our pipeline in the pre-pharmacy students, as well as our pharmacy technicians. Next slide, please. So I'd also like to give a shout out to our NHPA student chapters who have all been very active and also contributing to our Hispanic populations across the states, not only in the West Coast, Midwest, Southwest, Southeast, and Northeast. And I want to give a special recognition over to the University of Georgia for representing the Southeast. So thank you so much. Next slide, please. So this has been our board for the past 3 years. Just to mention the names of our board, including Dr. Mark Diaz, Dr. Christopher Alvarado, Myra Boitel, Dr. Carolyn Hall, Debbie Perales, Dr. Elena Rios, and Dr. Lisa Marie Serrano, as well as myself. So this has been your leadership over the last 3 years. Next slide, please. And I very much appreciate being able to have that face interaction. During these times, unfortunately, we have to keep this virtual format, but I did want to show visually who everyone is. Starting at the very top, we have Dr. Christopher Alvarado, Dr. Serrano. Bottom left, we have Debbie Perales, we have Dr. Mark Diaz, Myra Boytel, Dr. Carolyn Hall, myself, and Dr. Elena Rios, just to kind of put a face to a name. So welcome from every single one of us. Next slide, please. And at this moment, I would like to take this moment to recognize one of our inaugural NHPA board members, Dr. Christopher Alvarado from San Antonio, Texas. It has been a pleasure to work with Dr. Alvarado on the NHPA board of directors. During his time on the board, he was co-chair of the membership committee. His dynamic personality brought energy to the organization. The NHPA board and I thank Dr. Alvarado for his service and look forward to his future contributions as the Southwest Regional Director. Dr. Alvarado, thank you so very much for all of your contributions. Much appreciated. Next slide, please. And this is the new incoming board for the next 3 years. We have also elected our officers, and I'd like to present them to you all today. For the presidents for this upcoming year, I will continue on in that position for the upcoming year. Our president-elect is Myra Boytel. Our secretary and program committee chair will be Dr. Lisa Marie Serrano. Our treasurer will be Debbie Perales. Our development committee chair will be Dr. Carolyn Hall. Our executive director is Dr. Elena Rios. Our NHHF advisors, Dr. Mark Diaz, and our 2 new incoming board members, Dr. Gabriela Cipriano from New York, welcome, we're happy to have you, as well as Dr. Tina Lopez from San Antonio, Texas, also welcome, we're very happy to have you. Next slide, please. And this is our past organizational structure. And over the past year, the board and I, we've been very tirelessly working on updating our bylaws as well as restructuring our organization. And I'd like to present to you all our new structure, organization structure. Next slide, please. Which is this one right here. So we still have our corporate advisory committee as well as our board of directors, but within the board of directors, we will have our executive director overseeing the staff, and the staff without whom the rest of our programs wouldn't be able to really function. So our staff will supporting the regional directors and as well as the committees. The president-elect will oversee the regional directors as well as the assistant regional directors and our chapters, currently mostly students, but may grow in the future, hopefully will. And our board members will be chairs of the program committee and the development committee. The program committee will consist of the professional, the program committee will consist of the development committee will consist of the sponsors subcommittee, the membership subcommittee, the finance subcommittee, and the subcommittees within the program committee will consist of the professional development, patient education, pipeline, and research. Next slide, please. And so again, once we had to go and update these bylaws, we also decided to organize the regions so that we could have the West region, the Midwest region, Southwest, Southeast, and Northeast, hopefully so that within these regions, there could be even more cross collaborations, closer proximity, easier in terms of time zones and networking opportunities for all of our members. Next slide, please. And I'd like to present to you all our leadership for the upcoming year. These will be our regional directors and assistant regional directors. For the West Coast, we have Dr. Mario Jimenez. Midwest, we have Cynthia Perez. Southeast, we have Dr. Christopher Alvarado. And for the NHPA assistant regional directors, we have for the West, we have Yvonne Alva. And for the Southeast, we have Diana Pimentel Dominguez. We do have some vacancies, and if you're interested, please email me as well as our executive director. Next slide, please. For the program committee, our chair is Dr. Lisa Serrano. Subcommittees, the professional development subcommittee chair is currently vacant. Patient education subcommittee chair is Dr. Anibal Ubaque. Pipeline Subcommittee Chair is Dr. Jason Cota, and then Research Subcommittee Chair is Dr. Beatriz Mansour Misrick. Next slide, please. For the Development Committee, our Chair is Dr. Carolyn Ha. Sponsors Subcommittee, it's currently vacant. Membership Subcommittee Chair is Dr. Milda Medina. Finance Subcommittee is Debbie Pereles, who's our Treasurer and Board Member of NHPA. And Legislative Subcommittee Chair is Dr. Diana DeVore. And for any of the positions who currently have vacancies, again, if you are interested, please email myself and Dr. Elena Rios, and we'd be happy to consider your application. Next slide, please. All right, so here we have our NHPA staff. And again, I want to give a huge recognition for all of them. You know, actually currently right now, they're helping us be able to provide this annual conference to you all virtually. Starting off with Dr. Elena Rios, who's the president of NHHF and the executive director of NHPA, as well as Dr. Mark Diaz, who's the chairman of NHHF and our NHHF advisor for NHPA. We have Jean Duval, who's our controller, Jasmine Alfonso, who's our director of programs, Marissa Lewis, a programs coordinator, Dylan Garcia, communications manager, and Wanda Salcedo, administrative assistant. So huge recognition to you all. Thank you so much for everything that you do day in and day out. Next slide, please. The direction for this upcoming year for NHPA. We do have a few of them, and with the help of the incoming leadership, I'm confident that we will be able to achieve them. So to build a leadership of NHPA through committees in the regions, expand the programs of NHPA, collaborate with other organizations on efforts to improve Hispanic health, continue to develop the NHPA with partnerships and funders, and provide guidance and networking at the regional level with professional members and the NHPA chapters, and then build the capacity of NHPA to support its own infrastructure. Next slide, please. And I would also like to take this moment to recognize our NHPA sponsors, corporate sponsors, and corporate committee, advisory committee includes of CVS and Pharma. And our non-corporate sponsors includes NHHF and Walmart. I would also like to say that if anyone would be interested to sponsor NHPA at any level, whether it's corporate or non-corporate, please do let us know. And please contact myself and Dr. Elena Rios. We'd be happy to have you on board. Next slide, please. And there's a multitude of ways to connect with us on social media. Here are some of the links. We are across the spectrum. Next slide, please. And here's a way to contact us at the office. Next slide, please. Okay, so now what we're going to do is go ahead and present our incoming leaders. I would have loved to be able to give everyone a spotlight and a moment here during the annual conference. And we decided that the best way to do that is to actually provide you a video so that you can see who the leadership is. I'm also going to take this moment to put in a plug so that if anyone is interested in becoming a member of these subcommittees, please be on the lookout for more information from our newsletters. Your leadership will be sending you communication so you can join their subcommittees. So here we go with the first presentation. Next slide, please. Okay, so here is Dr. Gabriela Cipriano, NHPA board member, and she's from New York, and this will be her first year as a board member.
Hi, my name is Gabriela Cipriano. I'm currently serving as one of the board of directors for the National Hispanic Pharmacist Association. I'm an associate professor at the Wegman School of Pharmacy at St. John Fisher College in Rochester, New York. I have my doctorate in pharmacy. I have a pharmacy practice and clinical teaching site at a community health center at Jordan Health Center. This is a federally qualified health center where I have the privilege of serving our Hispanic patient populations, our Hispanic Latin communities, and provide further medication and disease state management under what's called a collaborative practice agreement with several of the doctors here. I've been doing this for a little over a decade now, and I am now most excited for being a part of an organization, this organization, the National Hispanic Pharmacists Association, that I know will further enhance my ability to advocate for our profession within the Hispanic communities, hopefully increasing and improving that patient-provider language and cultural concordance, and also at the same time providing that strong support network for several of our Hispanic professionals as we work towards improving the overall health of our Hispanic patients.
Okay, and next up we have Dr. Tina Christy Marie Lopez from Texas. She's also an incoming board member.
Hi, I'm Tina Christy Lopez. I'm one of the new board members for the National Hispanic Pharmacists Association. I am here in San Antonio, Texas. I am a pharmacist with Walmart. I also get to help with all of the clinical metrics as a pharmacy clinical services manager. I'm really excited to be a member this year and help with increasing the membership. Walmart being such a huge company, we have quite a few Hispanic pharmacists in our area, especially here in South Texas, so I'm excited to start increasing our membership.
Wonderful. Up next, we have Dr. Cynthia Perez, who will be the Midwest Regional Director, and she's from El Paso, Texas.
Hello, my name is Cynthia Perez, and I am the Midwest Regional Director for NHPA. I'm currently a practicing community pharmacist out of El Paso, Texas, and I look forward to working with NHPA on a larger scale to give back to all of our communities.
And up next, we have Dr. Chris Alvarado, who is our Southwest Regional Director, and he's from San Antonio, Texas.
Hello, my name is Dr. Chris Alvarado. I am a staff pharmacist at HB Pharmacy in San Antonio, Texas. I'm a graduate of IWFI School of Pharmacy in San Antonio. I was a proud member of the inaugural class of 2010. I'm a board of trustee for the University of Incarnate Word, and I'm current president of the Alumni Association. I was honored to participate as an original board of director for NHPA. I'm now very excited that I get to stay on as a regional director for the Southwest region. I'm very proud that my alma mater, the University of Incarnate Word, had the very first student chapter for NHPA. I look forward to working along with the board of directors and the new committee and subcommittee team. I'm excited at the growth of NHPA in just 3 short years as an organization.
And for the next video, we have Diana Pimentel Dominguez, who's a Southeast Assistant Regional Director, and she's from Georgia.
Hello, my name is Diana Pimentel, and I am NHPA's Assistant Regional Director for the Southeast region. I'm currently a rising second-year student at the University of Georgia College of Pharmacy and president-elect for our local NHPA chapter. I'm an intern for Publix Pharmacy. It's a very big grocery chain here in the Southeast region, and I aspire to one day be a public health pharmacist and improve the health outcomes in the Hispanic community. I'm very excited about this position because it's a stepping stone towards my life goal, and as Assistant Regional Director, I hope to get in contact with other pharmacy programs here in the Southeast to start their own NHPA chapter and impact their Hispanic community.
Wonderful. Our next video is by Dr. Aníbal Ubaque, who is the Patient Education Subcommittee Chair, and he's joining us from Florida.
Hello everyone, my name is Aníbal Ubaque. I'm the NHPA Patient Education Subcommittee Chair. I'm also a Pharmacy Clinical Services Manager for Walmart based out of Denver, Colorado. During Hispanic Heritage Month, I had the amazing opportunity to be a guest speaker at Pharmacists Caring for Our Latinx Communities networking event, and that opened my eyes. I was able to share some of the challenges and obstacles that our Latinx communities are facing in our field. I was able to share some best practices that we can implement to overcome those obstacles and challenges. And that's why I'm so excited to get started and work with you all. No matter if you're a student, a pharmacist, or in another industry, we can all work together to improve the overall health outcomes of our Latinx communities. So thank you so much for your time, and I can't wait to get started.
Wonderful. And our next video is presented by Dr. Beatriz Manzor Mitris, who is the Research Subcommittee Chair, and she's joining us from Michigan.
Hello, my name is Beatriz Manzor Mitris. I'm a graduate of the University of Michigan College of Pharmacy. I completed a PGY1 residency at the University of Michigan, and most recently I completed a postdoctoral research fellowship. Currently, I am the clinical assistant professor at the University of Michigan College of Pharmacy. My research is in medication-related health disparities among Latinx adults with chronic disease. I'm in the Midwest region. I'm currently the research committee chair, subcommittee chair for NHPA. I'm very excited about working with the members of the research committee, the board of directors, and other committees. Specifically, I'm thrilled to lead the research subcommittee because its mission and vision are so in line with my research program. NHPA recognizes the need for evidence-based prevention and care grounded in Hispanic patient-centered research. In addition, there are very few Hispanic researchers in pharmacy, as well as very few pharmacy researchers doing Hispanic-focused research. All of this is complicated by the fact that Hispanics have disproportionately higher rates of morbidity and mortality compared with non-Hispanic whites. That is why it is so important to do this work. Furthermore, because many of these disparities are founded in social determinants of health inequities and structural racism, it is key that Hispanic researchers do this work to improve health outcomes for Hispanic patients. I'm excited with my new position and excited to work with you and meet all of you. Thank you so much.
Excellent. And now we have Diana DeVore, who is our legislative subcommittee chair, and she's joining us from California.
Hi everyone, my name is Diana DeVore. I'm an ambulatory care pharmacist here at Kaiser, Northern California. I am one of the legislative chair committee members for the National Hispanic Pharmacy Association, and I look forward to working with everyone. Thank you so much. Bye-bye.
Wonderful. And now we have Dr. Amilda Medina, who's our membership subcommittee chair.
Hello everyone, my name is Amilda Medina, and I'm going to be serving as your membership subcommittee chair for this upcoming year. A little bit about myself. I was born and raised in Houston, Texas. I am also a first-generation student in my family. For pharmacy school, I went to the University of Houston College of Pharmacy in Houston, Texas. After pharmacy school, I worked as a staff pharmacist at CVS Pharmacy for 1 year. And right now I'm currently in my PGY1 year of an HSPAL pharmacy residency program with One Health in Winston-Salem, North Carolina. I'm very excited to be serving as your membership subcommittee chair for this upcoming year. I am very excited to work together with the team to reach our goals for our members and get to meet all of you guys. I can't wait to meet all of our current and also our future members that we will have this upcoming year. Thank you so much for letting me serve you on the team for this year, and I can't wait to see what we will do.
And then up next, we have Dr. Elena Rios, who is our executive director, and she is also on the board of directors here at NHPA. She's joining us from DC.
Hi, I'm Dr. Elena Rios. I'm the executive director of the National Hispanic Pharmacists Association and also a board member. And I think I'm very excited about the next 3 years with the new board of directors and the new leadership coming on board. And my message would be to think about all the contacts you have to find more members and of course more sponsors so that we can have more professional development mentors for all the pharmacy chapters of students that we have. So enjoy.
And we also have Dr. Jason Cota, who will be the Pipeline Subcommittee Chair, as well as Dr. Mario Jimenez, who's the NHPA West Regional Director, and then also Ivan Alva, who is our NHPA West Regional Assistant Director. Welcome to everyone. Next slide, please. So our keynote speaker is Dr. Sandra Leal, who's the Executive Vice President, Tabula Rasa Healthcare, and also Professional Affairs. Of note, if you have any questions, please go ahead and enter them into the chat box. Once we get to the Q&A session, we'll go ahead and read out loud. I'll go ahead and read out the questions, and then Dr. Leal can address your questions. So thank you so much, and welcome, Dr. Sandra Leal.
Thank you, Dr. Hearns-Rivas. Nice to see you, and thank you for the opportunity to speak today on this very special day. I remember I was part of the first annual meeting for the National Hispanic Pharmacists Association, which was actually held during the time that I was running for president of the American Pharmacists Association. So now I sit here as this current president for the American Pharmacists Association, which is an honor to represent pharmacists, but I am most, proud of being a Hispanic pharmacist. And the reason that I am so proud of that is because I wanted to be a pharmacist because my family growing up, I grew up in Nogales, Arizona. We would go to the pharmacist for our care, for our primary care, for everything, because my parents didn't speak English. They were immigrants, and they would go to the pharmacist in Mexico for all their care. So for me, primary care was the pharmacist. It was going out and asking questions of the pharmacist. And so that's what I wanted to do. And I also wanted to be able to be a person that was bilingual. I could speak to populations and to help people in the language, in my native language, which is Spanish. And just a little bit of background about my practice before I get started on the actual topic is that my first position was at a federally qualified health center. I actually was a promotora de salud. That was my first job in high school. I was a teen health promoter. And then my career, the beginning of my career, for 14 years, I worked at a federally qualified health center in Tucson, Arizona, working in a collaborative practice clinic, delivering diabetes care. And so I have a passion for diabetes management. So today, though, my topic is going to be that which is around the theme of COVID, because another big passion of mine is public health. And so we know pharmacists have been playing a tremendous role in public health. And so that was what I was going to speak about today, because I know that all of us can make a big contribution in helping Hispanic people have better outcomes and hopefully less morbidity and mortality as a result of COVID. So we'll go to the next slide, please. So this is just the theme, which is La confianza empieza con nosotros. So trust starts with us. And I really believe that this is one of the key things that we need to focus on as we're trying to work with individuals to convince them about making sure that they obtain the COVID vaccine. One of the stories that I like to share is that when I started seeing the pandemic, and I was tracking it very early, before it was really in the United States, I was already seeing videos in China about it. And I'm like, oh my gosh, when I saw the first case hit the United States, I was like really concerned about it. I've always been a vaccine champion. Previous to COVID, I was part of a campaign called Flu Fighters for the Centers for Disease Control, and I recorded videos in English and in Spanish to get community members to be able to vaccinate. So it's really important to communicate information. So as soon as the opportunity became available to participate in a study, I enrolled myself in one of the COVID vaccine trials. And I knew early that it was going to be very important to do that so that I could build trust with my own family members, my community members, to be able to convince them that the vaccine was safe and that it was something that they could take so that they wouldn't end up having, a significant impact from it. Of course, I was a little bit concerned being one of the first people to sign up for it. I ended up going into the vaccine trial right around September of 2020, and I received the placebo, but I was unblinded and received the first vaccine in 2020. So the first dose of the two. And so it was a significant a tremendous advancement to be able to do it in the same year that we had the first presentation of the COVID virus in the United States. But it has been tremendous to be able to share my experience, especially because I wanted to make sure there was diversity in the studies, something we don't see a lot of in clinical trials still to this day. And I wanted to be one of those first initial people to get vaccinated to share that experience. So if you go to the next slide, please. So why is this so important? So very important because what we're seeing is just in tremendous disparity in who is experiencing infections, hospitalizations, and deaths by race and ethnicity. So if you look at this graphic by the CDC, we see that certain populations experience significantly worse outcomes than other populations. So specifically, I'm going to focus on the Hispanic and Latino population. You see that there's a twofold increase in Hispanics experiencing COVID as compared to white non-Hispanic individuals. Hospitalizations is threefold higher, and then death is 2.3-fold higher, again, than the white non-Hispanic individuals. The only population that is even worse is those American Indian or Alaskan Native non-Hispanic individuals. And so this is unfortunate because what we've seen is just a tremendous amount of disparities in certain populations. And so I've been tracking this and trying to make an impact and reducing these numbers so that there is no deaths, no hospitalizations, and no infections, but definitely not seeing a disparity in any of these. Next slide, please. When looking at more statistics around the cases per 100,000 people, so really to try to balance out how we compare relative to others, you can see in this graphic here, the Hispanic or Latinos are really, really high. They're pretty much the highest except for 2 or more races and some other races. So you can see that the cases are tremendously high for Hispanics. So again, a disparity there. And the next slide, please. That was for cases. This is for hospitalization. And I like this graphic because it shows you in the light green bar, the total Hispanic population, and then the actual cases of hospitalizations within that population. So as you can see for Hispanics or Latinos, you see 26.5% of the hospitalizations, even though they make less than that percentage of population. And you can see how that's inverse for white non-Hispanic populations. So the population is much higher and their hospitalizations is less than the proportion of the population that they represent. So what this is showing us is that even though we don't represent, the vast majority of the population, we are experiencing a very high number of hospitalizations relative to the proportion of the population that we represent. And this is interesting too, because we're not even collecting all of the race and ethnicity data. If you've been tracking early on, we did not collect race and ethnicity as we probably should have been doing historically. And sometimes it's technical barriers. It's people not asking the questions. So how can we design solutions if we don't know which areas or which populations are being impacted if we're not asking the question? And I think about that in the context of pharmacy. When pharmacists are out there dispensing, even the dispensing systems where we record dispensing hasn't historically allowed for us to collect demographic data like it should. That's starting to change. That was part of the investment to start collecting race and ethnicity data, but it's still not 100% there yet. So just even working with vendors, representing the need to do this is very critical for us as pharmacists to be advocating for this. Because if we collect this accurately, then we can start basically directing resources to those areas that experience the most health disparities and the most challenges, and we can start really making inroads into those. So it really does start with understanding and then collecting information about it, and then being able to then target those areas that need the most. That is more of a forward investment in how we do that more effectively to avoid getting into the situation again. Next slide, please. So this is the actual weekly case and deaths per 100,000 population by age, race, ethnicity, and sex. And if you look at this graphic, you can see right here around November 2020 to about March 2021, the huge spike, the green arrow representing Hispanics. So we saw significantly higher incidence in this population, in our Hispanic population, American Indian and American Native Americans too. So that is a significant jump. And you can see how much of that difference is between those two groups and then the other groups. And even though it's improved, it's come down, you still see that the green line representing Hispanics is still pretty high consistently across the board. So one of the reasons for that is because Hispanics are overrepresented as essential and frontline workers. We see the Hispanic population definitely out there. They didn't have a lot of the luxuries of being able to work from home or have flexibilities in their work situation, because we represent the essential and frontline workers significantly. Next graphic, please. And other things to consider is that, about 1/3 of the agricultural workforce is Hispanic. So another board I sit on, aside from the American Pharmacists Association, is the National Center for Farm Worker Health. I've been on that board for, I want to say, about 13 years now. And it is tremendous that, a lot of the people that are collecting the foods, that are working as farm workers, are Hispanic. And when I've been out into the fields, when I visited with these individuals, there's a lot of reasons why it's very hard to prevent COVID. The housing situation when you're out in the field is very communal. There isn't a space to separate or to have, a quarantine situation or isolation. You are living together in a small housing situation. In general, also, the Hispanic population is more likely to live in multi-generational households where you can see infection spread more frequently. So I think about that with my own family, my mom, my nephews, my cousins. We all get together. Sometimes we have family members staying here, and that's just because we like to be with our family, and that is a great thing about our culture. The situation when we have a pandemic like this, it's hard to separate, right? It's hard to isolate when this is part of how we live. We also saw tremendous language barriers. I won't forget this because it was so, I was acutely aware of this when information started coming out about the pandemic. We started to see information out there about what to do, even when they were screening people for potential exposure. There was not a lot of information available in Spanish. And I remember one of the platforms for pharmacists, it's APHA Engage. People were asking, hey, has anybody translated this information? Has anybody seen this in Spanish? And I remember going through and looking at the CDC information to see if they had any of those materials that they had created available in Spanish. And unfortunately, there was a lack. So even though we saw that, some of the most impacted populations were dramatically impacted in a worse way, the language material to help support them was lagging in significant amount of time and effort. So we ended up translating some of that information. It eventually started to come out, but there was definitely a delay there. And then other issues that we see that are of significance are, access to health insurance. We know that the Latino population has an uninsurance rate that's 2.5 times higher, fold higher than those rates for white. So if you don't have health insurance, if you don't have access to care, it's much harder to go and be seen because of the fear of medical bills, or you simply can't afford it, or you potentially haven't established care. So some of the worst outcomes initially occurred with people that delayed care. So again, things to think about and as to why we were disproportionately impacted. And then the issue around undocumented immigrants. We saw that there was a lot of concern around even seeking care because of the fear of being detained, the fear of being impacted by this in a negative way. So those were some other factors that really perpetuated the situation even more. And we still see this happening today. Next slide, please. So what are the challenges we're facing right now? Well, we're facing a lot of challenges. And some of the most common things we're seeing is a lot of misinformation. We're seeing information coming in from all countries, not just the United States, but I know my mom is receiving WhatsApp, information from Mexico, from Argentina, from all these places with misinformation, untrue statements, with hoax, with myths, with things like that that we know are not true. And so we're having to combat that. I mentioned the language barrier situation. When we don't have the accurate information available, even in English to the extent that we need, then we have a deficit when we don't even have it available in Spanish or any other languages. And then the fears around immigration enforcement are also hampering the Hispanic community. And I wanted to share this report because I saw this earlier this week. It was this past week. You might have seen the headlines, and it read, there has been the largest decline of life expectancy since World War II. and the US life expectancy dropped by 1.5 years. If you clicked on that article and read about a paragraph to two in, this statistic is even more appalling. Black Americans lost 2.9 years of their life expectancy, while Latinos who have longer life expectancies than non-white blacks or blacks or whites, they saw a drop of 3 years. So Hispanics saw a drop of 3 years, and the headline was 1.5, which was shocking. But to have a 3-year loss in our Hispanic population because of COVID is incredible, right? So this is what we're up against, and this is happening right now. So what can we do? Next slide, please. So I've been part of some campaigns that are just different, right? These are different types of campaigns to really start building la confianza, to start building the trust. This is a campaign that was done here in Tucson, Arizona, where I live now, and it is called Vaccine After Dark. So we actually ended up going out into the community, not into a pharmacy, not into a health center, not into one of the pods, but we actually went to high traffic areas, and some of them included local churches, the swap meet. This happens to be right downtown Tucson on 4th Avenue, where a lot of people walk by. And I actually volunteered, not for a medical volunteer, but for non-medical. And I ended up standing out right in the sidewalk where these people are walking by and just asking people, hey, come on in. We have vaccine right here, right now. At this particular time, we have the 3 vaccines available. And one of the individuals that's pictured here was walking by, pushing her cart, selling little souvenirs. And I asked her, I said, hey, ¿quieres una vacuna? And she's like, she didn't speak English. She's like, started asking questions. She's like, no, I don't have any insurance. I'm like, that's okay. You don't need insurance. She's like, well, I don't have any documentation. I'm like, it's okay. You don't need any documentation. And she's like, well, I don't read or write. I'm like, that's okay. I can help you fill out the paperwork, whatever you need. And then she said, well, who's going to watch my cart? I'm like, I'll stand here and I'll watch your cart with you. I'll wait with you until you're done, all in Spanish. She's like, oh, wow. Okay. I never thought I could get this vaccine. I'm like, absolutely, you can get it. So it was just that interaction on the sidewalk and spending a few minutes with her, explaining to her she didn't need insurance. She didn't need to learn how, know how to read or write. She didn't need any documentation. It wasn't going to cost her a thing. She came in, she got her vaccine, and she was happy. She actually signed the permission for this picture because at the same time, the Arizona Republic was there doing a story on these vaccine events. And so it was one of the most personally satisfying exchanges I've had with an individual, and a very significant public health experience for me that I probably enjoyed more than being in any practice I've been in many years. Because I know that had I not been standing that day in that sidewalk, that individual would have probably walked by and nobody would have tapped her shoulder to say, come on in, get a vaccine. And we had so many stories that day. I think I stood out there for maybe about 3 hours, and I ended up convincing 25 people to walk in and get a vaccine that had already said, oh, I wasn't going to get one. This is okay since you're here. All these little things about what worked that day that would have not happened had we not done these outreach efforts. So these are how you start building trust and how you start building la confianza, so people can come in and get the vaccination. So that was a great, great event. So next slide, please. So, what do we need to move towards more health equity? Because this is really what we need, and not just for this. I mean, I know we're talking a lot about COVID, but I mentioned earlier, my specialty is diabetes, and we have a pandemic that's right around the corner here with prediabetes. 88 million people in the United States have prediabetes, and unfortunately, again, a condition that disproportionately impacts Hispanic populations of people of color. So I have a few thoughts about this if you want to go to the next slide, please. And it really is, some of these are not solutions that we're going to address today, right? These are solutions that we have to start planting the seed now and invest in, so that we know that maybe this investment is just for today, but it's going to be for 5-10 years down the road. But I just want to hit some of these because I think they're very critical. So the first one here is to address ingrained in health biases ingrained in healthcare systems and medical school education. So we know we have a lot of issues with our education. We don't have enough education on racism, structural racism, or biases that exist. And I think we're finally starting to have those conversations, not enough, but they are starting to happen. And some of the things that I've been very happy to see are, starting like focuses on populations, looking at what biases exist. And one of the ones I mentioned earlier was the one around studies not having enough diversity in the enrollment so that we know what the impact is on our populations. Things like algorithm tools, AI tools that don't incorporate the conditions of Hispanic population or other people of color, because the information being put into those systems are already biased going in. So how can you actually have better information coming out? And then just, looking at accountability for some of these metrics that we haven't measured before. Another area is really to consider supports to strengthen community resources, like investing in things that we know help people. I mentioned earlier how we went and did a community event like that, but investing in things like community health centers, safety nets, areas that are known to really be leaders in health disparities, that's very critical. We have to build and maintain trust by working with the community, looking at other solutions, not the standard solutions, because we know what we've been doing isn't working. We know it's not working, right? We don't have to like reinvent the wheel when we know things don't repeat things that don't work. But look at what community resources, what linkages, what relationships we can build to start having inroads to impact our population. And then addressing factors outside of the healthcare system. I really believe healthcare really starts outside of the clinic walls, outside of the pharmacy walls. But what are we looking at when we disregard things like housing insecurity, health, food insecurity? Those are things we need to look at. Water. We've talked a lot about water issues with Flint, Michigan, but this is an issue across the United States. And here in Arizona, we were particularly impacted with the tribes, because they had issue with how COVID was spread, because a lot of the households in the American Indian population didn't have running water. So how do you actually help people wash their hands more frequently if they don't even have running water? You have to start addressing these things in order to prevent these situations from continuing to happen. And then the last one is investing in infrastructure capabilities, right? How do we expand public health services? A lot of the public health departments have had their budgets cut significantly before the COVID pandemic. And even now, we have so many public health officials quitting. They're being harassed. They're being, attacked for conveying accurate public health information. So how do we actually invest in public health? Again, this isn't solutions that are immediate. These are investments we have to do continuing forward. But things like broadband access. How many households didn't have access to internet when they needed to have children be at home and do their home, education, and they didn't even have access to, to broadband or to the computers? They might have had one computer for a family of 3 or 4. Well, you needed 3 computers for 3 kids, right? If you wanted to stay at home. Things that we didn't even think about, but how do we start investing in this? How do we start investing in emergency preparedness? So that's my challenge to you today is, here now, I'm a big advocate of the role pharmacists play in public health and advocacy, and these are the kinds of positions that we need to take and that we need to represent. So we'll go to the next slide, please. So these are some of the strategies that I've already mentioned a little bit. I mentioned federally qualified health centers and the value that they bring because of their strength in addressing social determinants of health. Promotoras are incredible. I was a team promotora. The promotoras I continue to work with to this day are trusted health professionals. Not they're lay people, but they work with our health professionals to be a conduit for us to be able to do the work that we do. So the promotoras are trusted. The media is very, very critical, especially in the Hispanic community. We go to our Telemundos, to our Univision, to our radio, to all of these different mediums that are incredible and that can be very powerful, and they can be very negative if they're not sharing accurate information. So how do we also hold them accountable to share the right messages, the accurate messages, and have representatives that are speaking about true clinical information? Outreach events, like I mentioned before, they are very, very impactful. And especially if you have people that are able to go out there to talk to the people in their language, very impactful. One of the things I was able to do recently was I was able this week, actually, this past Monday, I went to the Mexican consulate here in Tucson. And in the Mexican consulates, they have these programs called Ventanilla de Salud, which is, they're funded by the Mexican government in collaboration with local partners. And here in Tucson, they actually partner with the federally qualified health centers. So the Ventanillas de Salud are out there providing health information and connecting people to care. They have mobile units, especially along the border region. And then they have a call center that's national based out of here in Tucson. And they've been doing a lot of COVID events. They do screenings for diabetes. But what they've been doing too is they've been doing Facebook live events. So if you go to the Mexican consulate in Tucson on Monday, I did an event, Facebook Live with the local promotora. And we talked about two things. We talked about pre-diabetes and we talked about COVID and the myths and the fears and all of these things around that. And that was a great event. And we share that with people. We share it and we've done it about 3 or 4 times now. But those are things that you can participate in and hopefully make an impact in. And again, it's just a different way to reach people that really need to be reached. And I'm going to mention pharmacists again. You know, again, I can't be more proud to be a pharmacist, be a Hispanic pharmacist. Pharmacists, we know we are very accessible, right? We know that 90% of the population lives within 5 miles of a pharmacy. I think most pharmacists know that statistic. And that's incredible to have that level of access. We were the essential workers in this country. We were the essential workers in other countries, Spain, Italy. When everything else closed down, the pharmacies and the grocery stores stayed open. The doctor's offices closed, the pharmacy stayed open. We were the ones that were actually the ones communicating messages, refills, questions, answers. In my current position, I do telehealth. And when we were calling people to do the comprehensive medication reviews, we were getting so many questions about which vaccine, are they safe, all of these different things. So we were sources of information for people that were otherwise not receiving information. So next slide, please. And this is my very last slide, but I just wanted to share some of the results about the impact pharmacists have been having. And this is for the federal retail program that was launched for the COVID pandemic. And you could see the vital role pharmacists have played in the COVID pandemic. This year, almost 100 million doses, so 99 million doses have been given by pharmacists. That is a tremendous impact in the way that we've been able to reach people in many places, in retail for sure, but long-term care settings, nursing homes, again, the community outreach events. And this is just statistics from the last 2 weeks since I printed it. 58% of the shots were done with people of color, 47% given by pharmacists in high social vulnerability index areas, 9,900 in pop-up clinics, and 2.9 million doses done in disproportionately impacted communities. So that's more than half of total US doses have gone and been given by the pharmacists. And more than half of all the adolescent doses have been given by the pharmacist. And these numbers will continue, especially as we start increasing the population that qualifies for the vaccinations to younger children. So I can't thank you all enough for participating in everything you've been doing pre-pandemic, during the pandemic, and we will continue to do after the pandemic. And I am again so happy to be part of this event. And I'm so happy to continue to represent Hispanic pharmacists. I want to mention, I'm only the 11th woman out of 166 presidents for the American Pharmacists Association, only the 2nd Hispanic pharmacist. And I think total of 166, we've only had about 4 or 5 people that have not been white, which is, we have a lot of work to do to catch up. So I hope that, you know, some of you will end up in that position to continue to represent. But thank you so much. And I'm here for questions. I see some in the chat, so I'll see what is coming up here. So let's see. All right, so which of the 3 vaccines was most wanted during the vaccine after dark? What company provided the vaccines? Do you think that influence people's acceptance? So we had the 3 of them, and there were different reasons. I actually, that night, it was pretty equal about which ones we gave. We had 3 tents, and they actually had 3 different colors, and people could pick. And I don't think that there was one that people leaned towards more than the other. It was mostly which one, there wasn't somebody sitting there already to get the vaccine, because, you know, you have to be monitored right after you get the first vaccine. In some instances, though, we did have some people that wanted the J&J because they didn't think they could come back to get that second dose. So that was more out of convenience because they potentially had a barrier to come back, but it wasn't disproportionate to the other ones. And I think most of them were accepted at least equally for that event. I don't know if that's the case just across the board, but that's what we saw that night. And then what company provided the vaccine. So we were actually, I was working with Pima County Health Department. So that was a public health department that provided the vaccine that night, and those three different vaccine types. So what is your mechanism to give them the second dose for those who require it? I'm not sure what you mean by mechanism. What we were doing, at least for the repeat, is we were setting up that same location every week. So people could come back and we would give them the appointment card already made so that they could come right back to that same site and get the vaccine the second time. The good thing too, though, vaccines for the second dose, now you can go to any pharmacy and get it. You don't have to go back to the original site. And so that's opened up with new information. So people, if they got it in a different state, they could come here and get the second dose. If they got it in a different pharmacy, they can come back within the window of the second dose being required. And those were the two questions I saw. Okay, the process. Okay, hopefully I answered your question, Beatrice. Any other questions that you have? Well, I thank you again for participating in this event, and I'm so excited about what the future holds. I know Dr. Elena Rios has been doing a tremendous job in representing medical doctors, and now I'm so happy that she's now helping with pharmacists to get representation. And I know I've been advocating for APHA also to make sure that we have representation, and inviting this group over for different committees we have with APHA, because I want to make sure we have people at the table representing the needs of the Hispanic population. That's very important to me. And so hopefully we can collaborate together and make sure that we have a voice wherever we're at.
Thank you, Dr. Leal. Thank you so very much for your presentation, and very inspiring, and very much appreciate all of the work that you have been doing. Very much appreciated. And Dr. Diaz says here, on behalf of the National Hispanic Health Foundation, thank you very much for your work.
Thank you.
And next slide, please. Okay, so we would also like to present to you all our NHPA graduates. So NHPA pharmacy student members who have graduated this 2021 year. We were able to present them with a graduation sash that has on their class of 2021 and NHPA, just the one that's presented here on the side. This was in sponsorship by CVS. And CVS has also awarded them a free one-year NHPA membership to our graduating students. So congratulations to everyone. We're very excited for all of you. And next slide, please. Our NHPA graduates are the following: Kimberly Ortega from Long Island University, Christopher Hernandez from Rosemont University of Health Sciences, Sarah Lewis from Toro University College of Pharmacy, Rodolfo Gonzalez from UC San Francisco, Nora Annette Cortez from UC San Francisco, Ashley Herr from UC San Francisco, Kristen Min from UC San Francisco, Catherine Mirza from UC San Francisco, and Emily Plasencia from UC San Francisco, my alma mater. Yolanda Martinez from University of Incarnate Word, Analika Recio from University of Incarnate Word, Tara Magallon from UNT, Yvonne Alva from Western University of Health Sciences, Carlos Garcia Martinez from Concordia University, Ana Gomez, also from Concordia University, and Emily Breet from Concordia University. So congratulations to you all. We're very excited, and we look forward to your enthusiasm as pharmacist members to continue to develop the organization, and then also to continue to bring your enthusiasm to all of the programs. So congratulations from all of us at the NHPA Board of Directors. Next slide, please. So up next, so we'll see you at the networking session. And next slide, please. Okay, so at this point, what I would like to say is thank you everyone for joining us today. It has been a great pleasure in having Dr. Sandra Leal, give us your keynote presentation. Very much needed, and thank you very much for advocating for us as an organization also to help increase representation at APHA. And yes, we also hope that we can continue your legacy there at APHA. In terms of the networking sessions that we will be having, we'll have 4 groups, 1 board of directors, regional directors, and assistant regional directors, Program Committee and Development Committee. And so with this being said, this will be my closing remark, and then we can break off into the sessions. I will be going into the different groups just to say hello to everyone and be there. And if you have any questions, please feel free to email us. Let's see here, earlier we provided the contact information for NHPA, and we look forward to hearing from you. And as I mentioned already earlier, please be on the lookout for the opportunity to join these committees as a member. And so thank you again for coming today. And now we'll proceed to our networking sessions into the various groups.